My name is Lucas Finn, and for my critical assignment, I will be discussing the identification, assessment, and prevention of injuries associated with men's college basketball. Being that basketball involves a fast paced, close quartered playing environment, injuries are definitely a common occurrence. Those most susceptible to basketball injuries tend to be females. However, the injury rate increases through adolescence and pubertal development for both male and female athletes. And of course, there are many intrinsic factors associated with these injuries, one being the hardwood playing surface that leads to overuse injuries and impact injuries. Now, for this assignment, I narrowed my focus down to men's college basketball at the elite high level of play, Division One, March Madness, those type of playing environments, which are very high intensity. And because of that, there are many injuries that may occur. But some of the most common ones, and the ones I'm going to focus on for this assignment, are the lateral ankle sprain, patellar tendonitis, otherwise known as jumper's knee, and finger sprains. In lateral inversion ankle sprains, typically an athlete experiences excessive, forceful inversion on the weight-bearing foot, causing stretching and even tearing or a complete rupture of the ligaments of the ankle joint. And that usually occurs when there's a combination of plantar flexion and inversion at the same time. Now, the ligaments that are affected in this injury tend to be the anterior talofibular ligament, calcaneotalofibular ligament, or the calcaneofibular ligament, and the posterior talofibular ligament, with the ATF being the most affected typically in an inversion sprain. To assess this injury, many ATs perform an interior drawer test, which involves the AT pulling the calcaneus forward and the tibia backwards simultaneously. And with this motion, if there's some extra space and wiggle room and even some subtle clunking noises that happen during this test, that means there is some damage and tearing to the ATF. Treatment for a lateral ankle sprain involves rest, ice, compression, elevation within the first few days of injury. Now, depending on the severity of the sprain, weight-bearing activity should be avoided for 2 days for a grade 1, for up to a month for grade 3 with a cast or a brace. And of course, during this time, for every level of injury, strength and range of motion exercises should be conducted while rehabbing. A good rehabilitation exercise to do following an inversion lateral ankle sprain is something called ABCs. And what this does is it reestablishes range of motion and a little bit of strength back into the ankle following injury. All you need for this exercise is a surface to rest the leg on and elevate the ankle so you can perform the range of motion exercise. And this is how it goes. So my leg is elevated, my ankle is relaxed, and I'm going to go A, B, C, D, all the way to Z. And as I said, we're going to do 3 sets of that, A to Z, every day. Once some range of motion is reestablished and there's a reduction in pain, the patient can progress this exercise by adding a TheraBand and some resistance to the ABCs. So once the ankle is back to full strength, what you really want to focus on is injury prevention at this point. And the best way to do that is to keep the ankles strong. And one exercise that's good for lateral ankle sprain prevention is single leg balancing. You can do 3 sets of these, 30 seconds each leg, and it's appropriate to do this every day. And what it is basically you're standing on one foot on an uneven surface, forcing your ankle to hold that stability. So it's reestablishing neuromuscular control to those little tiny muscles in the ankle that aren't normally activated in our everyday motions. So I'll show you what that looks like. All you need for this is an uneven surface and yourself. So for this, you could use a foam pad or a Bosu ball. I'm going to use the small pillow, and that's going to add some instability to the ground, forcing those tiny muscles to work. And I'll show you what that looks like. So I can step on here. I'm going to raise my foot up. I'm just going to hold it for 30 seconds. Like I said, we can do 30 seconds each leg. 3 sets of that every day. While this is good before any sort of leg exercise. It really wakes up those muscles and builds strength and stability at the same time. Another common injury associated with men's college basketball is patellar tendonitis, otherwise known as jumper's knee. And basically what that is it's an overuse injury to the patellar tendon. And it occurs in athletes that excessively jump, plant, and run on hard surfaces like a hardwood basketball court. And what's happening anatomically is that frequent contraction of the quadriceps femoris during movements like jumping and deceleration, movements that are common in basketball, that places an extra force on the tendon, which leads to small little tears and inflammation and eventual weakness. And on top of that, inadequate footwear and improper landing technique can also contribute to this injury. Assessment for this injury is pretty simple. What an AT can do is basically just palpate the tendon and measure the pain in the athlete, and also measure the pain involved in an eccentric squat. Now, common treatment practices for this injury involve a transverse friction massage or massaging horizontally across the inferior patellar pole. And what that does is it increases inflammation at the site of the injury, which brings more blood to the area, speeds up the healing process. And on top of that, evidence shows that bracing or taping the patellar tendon may decrease the load placed on the tendon during activity, which will reduce the pain and further injury. Off of it. And a good exercise to do during rehab is decline single leg squats. Basically, it's in the name. You're on one leg, you're on a decline, so your heel is elevated, so it's putting more stress on the interior muscles and on the patellar tendon. And you could do 3 sets of these, 8 reps each leg, 3 times a week. And I'll show you what that looks like. So I'm going to use this book as my elevated surface. I'm going to prop my heel up on that. I'm going to do my single leg decline squats. And I'm going to go slow and controlled, really. This is a low impact exercise. So I'm going to show you what that looks like. Get on my elevated surface, prop the heel up. You should feel this along the interior part of the body. So here I am, I'm on one leg, I'm going to go down super slow. Don't have to go that low to about right here, and then back up. If it helps to maintain balance, you could drag your heel across the ground. I'm going to do 8 reps of this. 3 sets, 8 reps each leg, nice and slow and controlled, reestablishing that strength in the muscles surrounding the tendon. One exercise you can do for patellar tendonitis prevention are glute bridges. And all you need for that is a ground surface, and that's about it. And we're going to do 4 sets of that, 12 reps, and it's appropriate to do this 3 days a week. And all you're going to do is you're going to lay down flat on your back, place a bend in the knees, and raise the hips up. I'll show you what that looks like. So for glute bridges, what we're going to do is we're going to lay back, get that bend in the knees, press the shoulders into the ground and raise the hips up and squeeze at the top. Really activate those glutes. I'll do that 12 times. 4 sets, 12 reps each, 3 days a week. Really got to strengthen that posterior chain. Now, to progress this exercise, what you can do is you can make it a little bit more difficult by raising one of the legs in the air and doing it on one leg. And I'll show you what that looks like. So same thing. Here we are. What I'm going to do is raise this leg up and elevate. So now I'm going on one side. And it's appropriate to do 4 sets of this, 10 reps each leg, 3 days a week. Lastly, another common injury associated with men's college basketball and basketball in general are finger sprains. And what a finger sprain is an injury to the finger digits that happens with excessive force placed on the finger, causing the ligaments of the finger to stretch past their limit, kind of like the ankle. Finger sprains may occur when the most distal part of the finger makes forceful contact with a person, an object, in this case being a basketball, or if the finger is hyperextended. And when that finger makes forceful contact with, let's say, a basketball in this situation, the ligaments at the distal interphalangeal joint, the proximal interphalangeal joint, and the metacarpal phalangeal joint may be placed under excessive valgus or varus stress, resulting in damage. Similar to an ankle sprain, it's suggested that rice is used during the acute stages of an interphalangeal sprain. So rest, ice, compression, elevation. And also splinting is very common with finger sprains. And for injuries at the proximal interphalangeal joint, the fingers should be splinted in a 30 to 40 degrees of flexion, while as injuries to the distal interphalangeal joint, or the most distal part of the finger, should be splinted in full extension for an adequate healing process. And all the while, during rehab, strength and range of motion should be worked on. So for finger sprain rehab, a good way to reintroduce some strength exercises and some range of motion is to do stress ball squeezes. So you're doing that squeezing motion, introducing some range of motion into whatever injured finger is there, and incorporating a strength aspect to it by adding some sort of resistance. I did say stress ball. I don't have one, so I'm going to use a sock. It's not too hard. And what we can do is we can do 5 sets, 10 squeezes every day. So 1, 2, 3, all the way to 10, 5 sets of that every day. And that's going to help reestablish some strength back into the injured joint. And to progress this exercise, what you can do is instead of squeezing with all the fingers, you can do one finger at a time. So say I injured my middle finger at the proximal interphalangeal joint. I'm going to go ahead and use my thumb and my middle finger and just squeeze with those. Adding a little more resistance, takes a little bit more strength to squeeze it because we're not using these fingers. It's a good progression exercise. Now, to prevent further injuries to the finger, we want to keep those fingers and those hands nice and strong. And a good exercise to do for injury prevention is isometric squeezes. So it's kind of like the stress ball squeezes, except you want to use a harder ball. So for this, you could use maybe a tennis ball. I'm using a lacrosse ball. And it's kind of like the stress ball squeezes where we're going to squeeze, but you're not getting anywhere. It's isometric. You're holding one spot. You're going to hold it. Okay, you can do 5 sets of this, 30-second holds every day. That's going to improve finger strength, grip strength,